General insight into hormone measurements. While it might seem logical to measure these hormones frequently in diabetes management, routine testing for insulin, proinsulin, C-peptide, and glucagon isn't typically recommended. However, there are specific cases where these tests can be useful. C-peptide testing is often needed for insurance coverage purposes, such as qualifying for an insulin pump or continuous glucose monitoring. It's also sometimes used to distinguish between type 1 and type 2 diabetes. Let's now dive into each hormone and its specific clinical utility. Insulin, understanding its role in clinical testing. Insulin is one of the main hormones responsible for controlling blood sugar, but its measurement is not always straightforward in clinical practice. Fasting hypoglycemia. Insulin testing is primarily used to assess fasting hypoglycemia, helping determine whether excess insulin is causing low blood sugar. Insulin resistance and secretion. It can also evaluate insulin resistance or how much insulin your body is producing. Type 2 diabetes treatment. While there's some thought that measuring insulin could help guide treatments for type 2 diabetes, studies haven't proven that this approach improves patient outcomes. Heart disease risk. High insulin levels may predict coronary artery disease, but this remains a controversial use of the test. PCOS. Measuring insulin was previously considered for evaluating polycystic ovary syndrome, PCOS, but this is no longer routinely recommended. Early diabetes detection. Insulin levels during an oral glucose tolerance test, OGTT, aren't advised for diagnosing early-stage diabetes. While insulin testing can provide useful insights, its routine use in diabetes management is limited. Proinsulin, a marker for beta cell tumors and more. Proinsulin is the precursor to insulin, and while it's rarely measured in routine practice, it has important clinical applications. Beta cell tumors. Elevated proinsulin levels can indicate the presence of benign or malignant beta cell tumors, even in cases where insulin levels aren't elevated. Type 2 diabetes. People with type 2 diabetes tend to have higher proinsulin levels, and this is linked to increased cardiovascular risk. Other conditions. Increased proinsulin can also be seen in conditions like chronic renal failure, cirrhosis, and hyperthyroidism. Measurement challenges. Testing for proinsulin can be technically difficult, but new assays like ELISA have improved its accuracy. Proinsulin measurements are particularly useful when investigating tumors or certain metabolic conditions, though they aren't a routine part of diabetes care. C-peptide, a key indicator of beta cell function. Unlike insulin, C-peptide is a stable marker that offers valuable information about pancreatic function and insulin production. Beta cell function. Since C-peptide better reflects the function of beta cells, the cells that produce insulin, it's often used in evaluating fasting hypoglycemia. Insulin injection versus tumor. It helps distinguish between insulin-producing tumors and insulin injection abuse, a common concern in cases of factitious hypoglycemia. Diabetes classification. C-peptide can help differentiate between type 1 and type 2 diabetes by indicating how much insulin the pancreas is still able to produce. Post-surgery monitoring. It's also used to monitor recovery or success after pancreatic surgery or transplants. Urine testing. Urine C-peptide can track beta cell function, but the results can vary widely between individuals, making it less reliable for routine testing. C-peptide testing offers significant clinical value, especially in cases where understanding the underlying insulin production is critical. Glucagon, important for tumor detection and pancreatic health. Glucagon is another hormone involved in blood sugar regulation, and its measurement can provide crucial information in certain conditions. Glucagonoma tumors. Elevated glucagon levels may point to glucagonoma tumors, which are often associated with skin lesions, diabetes, and weight loss. Low glucagon. On the flip side, low glucagon levels can be seen in conditions like chronic pancreatitis or during sulfonylurea therapy, which can lead to dangerously low blood sugar. While glucagon measurement is not common in routine care, it's vital for diagnosing rare conditions like glucagonoma and assessing pancreatic health. Insulin measurement, challenges and techniques. Although insulin has been measured for over 50 years, achieving accuracy and precision remains a challenge. Common methods. The most widely used technique is immunometric assays, although bioassays are more physiologically relevant but not commonly used due to their complexity. More accurate technique, stable isotope dilution mass spectrometry, IDMS, offers greater accuracy compared to immunoassays, but it is not yet routine in clinical labs due to its complexity. Immunoassay techniques. Exogenous insulin interference. Patients on exogenous insulin can develop anti-insulin antibodies, which interfere with measurements. To overcome this, polyethylene glycol, PEG, can be used to measure free insulin, or the total insulin can be calculated by eluting bound insulin. RIA procedure. Radioimmunoassays, RIA, involve using radioactive iodine-labeled insulin to compete with patient insulin for binding to an antibody, and a calibration curve is then used to determine insulin levels. Important considerations. 1. Overestimations. Immunoreactive insulin assays may detect proinsulin or insulin derivatives, potentially overestimating insulin levels. 2. Calibration. Human insulin is the standard calibrator, and results are expressed in international units, IU. 3. Mass spectrometry. While mass spectrometry provides more specific measurements, it is not widely used due to its complexity. 4. Assay variability. The American Diabetes Association, ADA, found high variability in insulin measurements across different laboratories. Performance recommendations. Laboratories are encouraged to evaluate their assays regularly, use common calibrators, and dilute high insulin values with a zero calibrator to avoid misleading results. Reference intervals. Fasting insulin levels in healthy individuals range from 12 to 150 picomole per liter, 2 to 25 microinternational units per milliliter. During a glucose tolerance test, insulin levels can rise as high as 1200 picomole per liter, 200 microinternational units per milliliter. Biological factors. Obesity can result in higher fasting insulin levels, while trained athletes often have lower levels. Insulin antibodies and their measurement. In some cases, patients may develop insulin antibodies, which can complicate the measurement of insulin. Quantitative radioimmunoelectrophoresis measures IgG antibodies bound to radiolabeled insulin. RIA with PEG. This method separates bound and free insulin using polyethylene glycol or a second antibody. Solid phase immobilization. Insulin is immobilized on test tubes or cephalose for detection. Proinsulin measurement, overcoming challenges. Proinsulin is difficult to measure due to its low blood concentrations and issues with antibody production. Cross-reactivity. Traditional antisera can cross-react with insulin and C-peptide, making accurate measurement difficult. Intermediate forms. Some assays may measure intermediate forms of proinsulin, complicating results. Improvements. Biosynthetic proinsulin. The development of biosynthetic proinsulin has improved assay accuracy, allowing the production of monoclonal antibodies and reliable calibrators. International standards. The International Reference Preparation for Human Proinsulin is now available for more consistent measurements. Reference intervals. Proinsulin levels vary by method, with fasting levels in healthy individuals ranging from 1.1 to 6.9 picomole per liter to 2.1 to 12.6 picomole per liter. C-peptide, a reliable indicator of beta cell function. C-peptide is often preferred over insulin for assessing beta cell function because it is less affected by liver metabolism or insulin antibodies. Measurement issues. Cross-reactivity with proinsulin and variations in antisera specificity contribute to differences between methods. Harmonization efforts. The CDC is working on harmonizing C-peptide measurements for better consistency. 2 IDMS methods have been developed to improve accuracy. Reference intervals. Fasting C-peptide levels in healthy individuals range from 0.78 to 1.89 nanograms per milliliter, 0.25 to 0.6 mol per liter. After glucose or glucagon stimulation, C-peptide values increase to 2.73 to 5.64 nanograms per milliliter, 0.9 to 1.87 nanomole per liter. Glucagon measurement, a complex task. Glucagon is measured using a competitive radioimmunoassay, RIA, but there are several challenges. RIA method. In this method, labeled glucagon competes with the patient's glucagon for antibody binding. Bound glucagon is separated using PEG and a second antibody. Calibration. The assay is calibrated using the WHO Glucagon International Standard. Methodological challenges. Some glucagon assays cross-react with other proglucagon peptides and lack sensitivity at low glucagon concentrations, making it difficult to measure accurately in some cases. Reference intervals. Fasting glucagon levels vary widely, from 0 to 20 nanograms per liter to 135 nanograms per liter in healthy individuals. In cases of alpha cell neoplasms, glucagon levels can rise up to 500 times the upper reference limit. Thank you for completing the video. Don't forget to share, subscribe, and hit that like button. Till next time, bye.